So Weston Park Hospital is a leading player in cancer research in the UK. We're in, you might call it, the Premier League, and hopefully well up in the Premier League, putting many thousands of patients into studies and clinical trials to help improve their outcomes and help them live longer and better lives with cancer.
There's not enough space with the current setup, either in the clinical area or in the area where we give the treatments either. Plus it is remote from Weston Park Hospital, which provides all our support, especially if we have an emergency.
We've really outgrown our centre. We are the victim of our own success, if you like. The trials portfolio has grown and we're attracting new studies that are more complex, particularly with our early phased experimental cancer medicine centre status. We're needing much more robust facilities that will suit the needs of the protocol and patient safety aspects.
A new integrated complex treatment unit will allow us to take forward novel treatments which we haven't been able to do before. These include the use of viruses and new drugs, and we're going to be able to use these treatments in patients earlier and earlier in their treatment plan. This is something we haven't been able to do as much in the past through lack of facility.
What we hope is that Sheffield is going to go from strength to strength. We're going to be having more clinical trials, more new drugs, more complicated drugs, things like viruses coming through, so all these things that just are a little bit different than what we're doing at the moment, and we want to be able to give those safely to patients. We need to have the space to do it, we need to have the nurses need to have the facilities there they need. We might need to monitor people more closely, so we need to make sure that we can do the tracings of the heart, the ECGs, that we can do the blood test there, that we can process the samples there. So the idea is to have all of that in one area.
The big difference for patients is that it gives them more opportunities to access new treatments at the earliest opportunity before they're available on the health service. For us to be able to do that, we have to have facilities that are of the highest level of safety and are appropriate for testing of novel drugs.
So this new unit will allow us to do this research into what we call phase 1, phase 2 studies, which is very early. So an example, we're about to do a study which will actually give a drug to a person, a human, for the first time ever. And we'll be hoping to do more of those studies in this new unit.
And I think in terms of having greater capacity in this new unit, it means that we'll be able to treat more patients and attract studies that are going to actually be compatible with the unit that we've got, because currently we are stifled with providing certain studies.